AIIMS chief Dr Randeep Guleria, in an interview to a TV channel, said that COVID-19 vaccines for children in India are likely to be introduced by the end of September. India began its inoculation drive in January with healthcare workers and opened access for senior citizens and those with comorbidities in March. The vaccination umbrella was then expanded to cover all above the age of 18 years by May. The next extension that is due is for children under the age of 18 for whom vaccines were still being tested. Dr. Guleria stressed that in order to break the chain of transmission of the virus, people of all age groups would have to be vaccinated because even as the severe effects of the virus were largely absent in children, they were still carriers of the infection. However, the second wave of COVID in India showed a departure from the first in that young children too were affected and some were battling a serious condition called multi-system inflammatory syndrome. Speaking to NDTV, Dr. Guleria said, "I think Zydus has already done the trials and they are waiting for the emergency authorization. The Bharat Biotech's Covaxin trials should be over by August or September, and by that time, we should get an approval. Pfizer vaccine has been already approved by the FDA, the US regulator for Food and Drug Administration. Hopefully by September, we should start vaccinating children, and that will be a big boost as far as breaking the chain of transmission is concerned." Dr. Guleria also said, "We need to get our own vaccines too. That's why both Bharat Biotech and Zydus are important. Getting the Pfizer vaccine will also be helpful as there is enough data to suggest it's safe, but we can't be sure if we will get required numbers. We will hopefully have more than one vaccine for children by September." India has given over 42 crore doses of vaccines so far and inoculated nearly 6% of its population. The government aims to vaccinate all adults by the end of this year.
Subscribe to Oneindia channel and never miss an update.